Hi, my name is Jessica, and I'm going to be doing a health history assessment on my patient James. And this is for my nursing intro to assessment class. So here we go. Hi, my name is Jessica. I'll be the nurse taking care of you today. I'm going to gather a little bit of health history from you today to get you in our system so that when you come back we'll be able to stay up to date on your needs. Can you tell me your name?
James
James. James, what is your last name?
Parsons.
James Parsons. When was your date of birth?
August 25th, 1984.
Do you prefer to be called by James or Mr. Parsons?
I like Mr. Parsons.
Okay. Mr. Parsons, where were you born at?
Tampa, Florida, at United Hospital.
Okay. Are you married?
Yep.
What would you say your race is?
White.
White, okay. Who was one of your previous doctors that maybe you've seen recently?
What's his name? Anyanwu.
Oh, he's at Forsyth Medical Center.
Yeah, he's my neurologist.
Okay. What were you seeing him for?
I have chronic migraines.
Okay. Okay, and why are you here today?
Just a standard checkup.
Okay. Mr. Parsons, is English your preferred language to speak in?
Only one I know.
Okay. Alright, so we're looking back at some of your childhood illnesses. Have you had measles, mumps, rubella, chickenpox, rheumatic fever, or polio?
I think I had chickenpox when I was a kid.
Okay. When was your last tetanus shot?
Oh, it's been 4 or 5 years since I've had a tetanus shot.
Would you say it was 2011, 2010,
maybe
2012?
2010.
Okay. Have you had your hepatitis immunization?
Yeah, I think I had one of those in the military too.
Okay. You were in the military?
Yeah.
Okay, well, that's
Tons of
great.
shots.
Are you still in the military?
No.
Okay. Have you had your influenza or flu shot?
Oh yeah, me and my wife went to go get ours on our anniversary.
Oh, that's a nice wedding anniversary gift. Have you had your pneumonia vaccine?
No.
Okay.
Not that I know of.
What about your chickenpox vaccine?
Yeah. That one
Okay. You must have had a low titer or something drawn because you had chickenpox when you
that
were
was
little,
something
right?
we did when we were in the military too.
Oh, okay.
We
had to get chickenpox first. Okay, I understand. What about your measles, mumps, and rubella shot?
probably not that I remember. I mean, I might have them when I was a kid.
Okay. Well, maybe next time when you come in to see us, that you'll bring a copy of them, so we can keep your chart up to date.
Where would I find a copy of those?
You can go to the health department where you live at. So when was your last examination date? Like, when have you seen a doctor last?
Oh, it's been a long time. I don't even remember. That was about a year ago.
About a year ago. Okay. Has there been any accidents or injuries that you would like to let us know about? Okay.
And I'd like to
Is there any medical problems? I know you said chronic headaches. Is there anything else?
Yeah, no, just I guess I got sleep deprivation.
Sleep deprivation. Okay.
I don't sleep good a lot. But I think we think that's what's causing my headaches.
Okay. Okay. So, has there been like some surgeries that you've had recently?
I've never been under the knife. I did have an appendectomy about a year ago.
Okay. And where was that done at?
Forsyth Medical Center.
Forsyth Medical Center. Okay. Was there any other hospitalizations that you want to let us know about?
No.
Okay. Have you ever had a blood transfusion?
No.
Okay. In case that you needed blood, would you accept it?
I'm not going to turn it down.
Okay. I'm not saying you need it. I was just saying
okay.
just in case. Just for our system. What type of medications are you using?
Extra strength Tylenol.
Okay. And what's the strength of that?
Oh, I can't remember.
I think in our system we have 625. Does that sound
Yeah,
close?
that sounds good.
And how often do you take that?
Every day.
How often?
Oh, like 2 capsules. Like all day long. Every 4 hours.
Okay, okay, that sounds good. Okay. Do you take any like multivitamins or over-the-counter drugs?
I take one. I can't remember complete.
Okay.
Complete multivitamin.
Yeah. Okay. Yeah.
Just take one a day.
Is there any inhalers? Is there herbal medicines, anything like that you're using? Okay. Continue down here. Do you have any allergies to medication?
No, I'm not allergic to anything.
Okay. What about food? Are you allergic to any type of food?
No.
Okay. So now we're going to move on to a section about your health habits and personal safety. All these questions, they're optional. They're kept strictly confidential, so this goes nowhere. It's just in our system so that we can better treat you. So let's talk about exercise.
Okay.
There's several different levels of exercise, and I want you to place yourself in whichever one it is, and I'll put it on the chart. Would you say that you live a sedentary lifestyle, meaning that you have no exercise? Or mild exercise, where you maybe climb stairs, walk through blocks, maybe even do golf? The next level above that is occasionally vigorous exercise, meaning you work or...
I don't do anything past that. We'll go with
mild
exercise.
Okay. So, I know that the term diet sounds like a fad diet or something on
yeah, I don't do much
TV.
dieting.
Are you on a diet currently?
No.
Okay. What's the number of meals that you eat on an average day?
I usually eat 3 a day. I don't get many snacks though. But
Okay. Would you say that your salt intake is high, medium, or low?
I'd say I have high sodium, not really salt, but yeah, I do have high sodium.
Okay. What about fat intake?
Yeah, that's pretty good.
Okay. So, talk about caffeine sources. Do you drink coffee, tea, cola?
I drink a lot of tea and cola. I don't drink much coffee.
Okay.
I do drink a lot of tea and cola.
What would you say, if you had to rank it on a number system, of how many numbers of cans that you drink daily, what would you say that you drink?
About 2 cans a day.
Okay, 2 cans. Okay. Do you drink alcohol?
No. I mean, I do every once in a while, but I don't drink it like enough. I drink like once or twice a month.
When was your last drink?
Oh, it's been almost a year.
Okay. Do you use tobacco?
Yeah, I use about, I smoke about half the time.
Chew?
No.
Pipe? Cigars? Or cigarettes?
Just cigarettes.
Or combination?
Just cigarettes.
Okay, and what would you say, a pack? Half a pack? Quarter of a pack?
Half a pack.
Half a pack. Okay. How long have you been smoking?
Oh, for 14 years.
14 years, okay. Do you currently use recreational or street drugs?
No.
Okay. Are you sexually active?
Yeah.
Okay. Are you trying for pregnancy?
Nope.
No. Okay. Do you have any discomfort with intercourse?
Nope.
Okay. You know, illness-related diseases such as HIV, AIDS have become a major public health problem. So there's several risk factors for this illness, including intravenous drugs, unprotected sex. Would you like to speak to our provider to get more information about your risk of this illness?
No.
Okay. Do you live alone?
No.
Do you frequently fall?
No.
Do you have vision or hearing loss?
What?
Vision.
No, I'm just kidding. I'm good.
Okay. Do you have an advance directive or a living will?
Yes, I actually do. I've got one of those.
Do you?
Yeah.
Okay. Can we have a copy of it?
I mean, I didn't bring it with me. I thought this was just a routine checkup.
Well, we like to keep those things on file to keep your chart up to date, just in case that, say, you went to our hospitals outside of the health clinic or places like that, they would actually have access to that. So if you brought it in, and we could put it in our system.
I'm sure
So next time that you come, maybe you can bring us a copy.
Yeah.
Okay.
You want it.
You know, physical and mental abuse have been a public issue along with the sexual transmitted diseases. This often takes the form of, for abuse, can be verbal, physical,
I get
or...
plenty of verbal from my wife.
Would you like to discuss this issue with your provider?
No, thanks.
So I'm going to try to gather a little more information about your family health history.
Okay.
Let's start with your father. How old is he, and if he's still alive?
I couldn't tell you. He's 65. I can tell you that.
Does he have any problems?
He has a metal leg where he got hit by a tractor trailer, but other than that, nothing.
Like anything, like I guess I'm looking for things that you could inherit.
No.
Okay. What about your mother?
Nothing really from her. She's got sleep apnea.
Okay. Do you have any siblings?
No, I don't.
What about your grandmother on your mom's side?
She has very severe arthritis.
What about your grandfather on your mother's side?
And he died of prostate cancer.
Okay.
Actually died of lung cancer. He had prostate cancer.
Okay. What about your grandmother on your dad's side?
Oh, I can't remember what she died of. I think it's hypertension.
Okay. I'll put that in the system here. What about your grandfather on your dad's side?
Oh, he had a stroke.
Oh no. Okay. How old was he?
He was 40 years old.
Okay. So now we're going to ask some mental health questions, okay? I'm going to ask you about how you felt lately. Is stress a major problem for you?
Yes.
Okay. Do you feel depressed?
Sometimes. Yes.
Okay. Do you panic when you feel stressed?
No, I don't.
Okay. Do you stress eat, or does that affect your appetite where you don't eat at all?
No, I've never had a problem where I don't eat.
Do you cry frequently?
No.
Okay. Have you ever attempted suicide?
No, afraid of hurting myself.
Have you ever seriously hurt yourself?
No, not
Okay.
on purpose.
I know you mentioned to me earlier that you had trouble sleeping. Is that
Yes.
a current problem?
It's been a problem for quite a while.
Have you been to a counselor?
I have before.
How long ago has that been?
I couldn't tell you.
Okay.
It was when I was a kid.
Okay. Now just a few more questions. This is a
Okay.
little more personal, I'm sorry. But this will just help us kind of get to know you better and know how we can treat you better. Do you usually get up to urinate during the night?
No.
Do you feel pain or burning when you urinate?
Nope.
Any blood in your urine?
No.
Do you feel pain or burning continuously?
No.
Do you have a burning discharge
What does that even mean?
from like your penis area?
No, nothing's burning down there.
Let me just update my system. Have you had any kidney, bladder, or prostate infections in the last 12 months? Have you had any problems emptying your bladder?
No.
Any difficulty with erection or ejaculation?
None.
Any testicular pain or swelling?
Nope.
Any sores, lesions, or discharge?
Everything's good down there, okay?
Okay. When was your last prostate exam?
Oh, I had it last year. It was about, I think, July.
Okay.
We had it.
Do you perform self-exams?
Every day.
Okay, that's good. So I noticed our major...
Hold on, what kind of self-exams?
Like monthly, it's usually not a daily exam, it's a monthly exam to make sure you're checking yourself, your testicle.
Oh,
every
yeah,
day
yeah,
to
I
make
check
sure.
those every day.
Okay, and if you want more information on how to do an accurate self-exam, we
Right,
can
no,
get
I'm
that
good
to you.
with that.
So I would say, what would you say your 3 top priorities of, or issues that are going on that we can help you, work on?
Well, I would like to quit smoking
Okay.
and lose some weight
Okay.
and get rid of my headaches.
Okay. Well, we have a great program here that will help with smoke cessation to help you cut down and be able to quit. I noticed a lot of smokers try to quit and they end up having rebound and smoke again. Our program helps you continue to stay off your cigarette. And for diet-wise, I also will give you a handout and get you to talk to our dietitian that will assist you with eating correct portions, correct foods, and help kind of help with your fat and salt intake. And as for the headaches, I know that Dr. Anyan Wu is treating you for those, but I think with a combination of smoking and your smoke cessation and diet, we'll be able to work closer with the headaches, and we'll talk to our doctor and help you, work to get that plan back in the right direction. Is there any questions for you, for me?
I think you did a good job.
Thank you.